So I'm sure you've seen someone choking before. It's quite scary. If you ever notice an infant choking, that's even more scary. So I thought I would put together this video of a choking infant. This is a double upload day, so this is the second video of the day. Grab a piece of paper and let's go. Hello and welcome to MK's Medical Review Series. This is a series on my YouTube channel where we look at medical topics in depth. Today we're going to be looking at choking in infants. If you haven't yet subscribed to this channel, please hit the subscribe button, hit the bell notification icon to receive a notification of such amazing content every time I post. So remember that choking in infants is often going to be caused by small objects that are being put into the mouth, things like food, toys, buttons, coins, balloons, and these can often cause severe upper airway obstruction, especially in infants that are below the age of 1 year. And most of these cases are going to be due to choking on a foreign body. Remember, when an infant is choking on a foreign body, you have to act very quickly, because if you don't, the infant will stop breathing. If they stop breathing, their heart is going to stop. And of course, that infant may result in or may end up dying. So just a little bit about the anatomy. Remember that in infants and children, the narrowest part of the airway is going to be pretty much the cricoid cartilage, which is just inferior to the vocal cords. Between the trachea and the esophagus, there is a tissue that's known as the epiglottis, which is going to be preventing anything from entering into the airway. So as you are swallowing, this epiglottis slides down and closes the trachea and prevents food from being aspirated, or anything or any foreign object from being aspirated. So remember that if these objects indeed are aspirated beyond the epiglottis, they may be stopped by the vocal cords in the larynx, and if they are at the level of the vocal cords or even below the vocal cords, they can potentially cause life-threatening airway obstruction. Because remember, whenever something is touching the airway, it irritates it, it causes some reflexes to happen, and this can further cause airway obstruction. So sometimes this object can be trapped between the vocal cords and the cricoid ring, and this can result in obstruction that is very difficult to clear. If a child is choking, you may see certain things, but often the child may appear as if they're crying or they're coughing, but no sound is actually being produced. This is known as a silent cough. Very dangerous sign. So the signs of severe upper airway obstruction include cyanosis, retractions, inability of the child to cry or make any sounds, weak or ineffective coughing, stridor. And remember, if the child is having this loud cry, or they are having significant sound, or they are coughing effectively, or they are breathing adequately, then the obstruction is not so severe. So if you perform any maneuver to remove this, you may actually worsen things. So in that incidence, don't do anything at that particular time. So the strong coughs and actually the cries can actually even help push out the object out of the airway. There are two maneuvers that I want to talk about in this video. One is known as the back blows, the other one is known as the chest thrust. But remember that in both of these maneuvers, you don't want to do them if you're suspecting that this child has stopped breathing because of other reasons. For example, if it's an asthma, if it's an infection, or whether it's a swelling, or it's a blow to the head in terms of head injury, you don't want to perform these maneuvers. These maneuvers should only be performed if there's a suspected obstruction which is due to a foreign body. And make sure that you consult ENT as quick as possible. So how do we do this? So the first step is, of course, you want to look for if this child is having an obstruction, determine if there is a severe obstruction, because this may endanger the infant's life. So you want to look for signs such as inability to cry audibly, cough effectively, or even breathe adequately. Things like stridor, which is this whistling sound that you hear on inspiration, your retractions, you may even have cyanosis where the child tends to appear blue. If the infant has a strong cry, like I told you, or they are coughing hard, don't perform this procedure, don't perform the maneuvers. If you determine that the infant indeed has severe airway obstruction, then you should proceed to perform these maneuvers. If you're at home or outside the confines of the hospital, now is the time to ask someone to call for an ambulance as you're beginning the first aid. So first of all, you're going to be holding the infant face down. I'll show you a picture of how this actually looks like. Face down along your forearm, and you can actually use your thigh to support. Then you're going to hold the infant's chest in your hands, and you pull the mandible so that the mouth can be open. And you should make sure that the infant is placed in such a way that the head is lower than the torso. The head is lower than the rest of the body. Then with your other free hand, so I presume you're going to be holding the child in your non-dominant hand, which is your left hand if you are right-handed. And with your right hand, you're going to be performing back blows by giving this 5 quick, forceful back blows between the infant's shoulder blades, and you're going to be using the palm of your free hand. Make sure that you check the mouth to see whether the aspirated foreign body is visible, and if it can be removed easily, then remove it. So this is how it looks like. As you can see, here is a non-dominant hand placing the infant's body and torso across the forearm, and then of course the hand is grasping the chest in that manner. The fingers are pulling open the mandible, though this one here is not really a good representation because it kind of seems like as if it's covering the mouth of this infant. So you're pulling with your fingers to open the mandible. Then of course with the heel of your palm, you're applying 5 forceful back blows to see if whatever has been obstructing the airway has been removed. And remember, you're supporting yourself with your thigh, just like in this picture. Then if the object does not come out and the airway is still blocked after the 5 back blows, then you're going to turn the infant face up. This time the back will be in your forearms, and of course the forearm is going to be supported by the thigh or on your lap, and then of course the head is going to be held in your hand, and it's going to be lower than the torso. You're doing this because you want to take advantage of gravity. Whenever you're applying this pressure, increasing the pressure in the thoracic cavity, increasing the pressure in the torso of this infant, it will force this object out of the airway, and it will force it downwards, or rather towards where the head is, because it's lower than the torso. So you're going to be placing 2 fingers in the middle of the infant's sternum, just below the nipples. Remember, you want to avoid the lower ribs. You may cause them to fracture. You want to avoid the lower tip of the sternum. And of course, you're going to be giving this 5 quick thrusts, compressing the chest. Now, this is how the thrusts are done. And remember that you're going to be compressing the chest about 1.5 to about 4 centimeters deep. Perform this 5 times. As you can see, the infant is, again, the back is laying on the forearm, which is supported by the lap or the thigh. Then, of course, the head is supported by the hand. And, of course, you're applying these thrusts. And you should compress the chest about a third to a half in depth. That's roughly translating to about 1.5 to 4 centimeters in depth. Perform this 5 times as well. So you should continue to deliver the 5 back blows followed by the 5 chest thrusts until the object actually has been dislodged or the infant becomes unconscious. And remember, if the infant is conscious, do not attempt to grasp the object from the infant. You may cause them to swallow it, or rather aspirate it, and it may worsen things. If the infant becomes unconscious or they are unresponsive, then you should shout for help and you should begin your CPR. If the infant is unconscious and you can actually see the object that is blocking, you can attempt to remove it with your finger. Then of course you can try to remove the object only if you can see it. After you have done all this, and if you have successfully removed the object and the infant is able to breathe, you should examine the infant as soon as possible and to check if everything is okay. Complications of this include rib fractures and rib injury, as well as internal organ injury. Some things just to keep in mind before I end this lecture. Remember, it's very important to use gravity as your friend, gravity as your ally. You want to keep the infant's head lower than the torso every time during the procedure. You should not perform the back blows or the chest thrust if the infant is choking and they can audibly cry, they can cough forcefully, and they're breathing adequately. And you should not perform these maneuvers if the infant has stopped breathing because of other reasons or other than the obstruction due to the foreign body. So things like asthma, infections, angioedema, head injury. In those cases, you want to perform CPR. Never should you perform a blind sweep of the infant's mouth with your finger. You may actually dislodge the object and cause it to sink even further. Then do not perform any abdominal thrusts. Do not perform a Heimlich maneuver that we do in adults on infants. I will do a separate video on choking in adults. If you want me to do such a video, please comment on the section below. Thank you for spending your time to listen to this lecture. I hope you learned quite a lot, and I hope you have functional information. This is not just for those that are in the confines of the medical realm, it's also for those that are in the general public. So share this video to someone, and you may actually save a baby's life. To Zambia and beyond, my name is Dr. Moses Kazevu. Until next time, bye-bye.